presenting on complementary and alternative medicine. What is complementary and alternative medicine? CAM is any health approach developed outside of mainstream Western or conventional medicine. The main differences between conventional medicine and complementary and alternative medicine is that conventional medicine focuses on understanding and correcting the underlying problems that are causing the symptoms. It has been criticized for treating the condition, not the person as a whole, whereas CAM tends to be more holistic and requires an individual to take an active part in his or her own treatment with lifestyle changes, including diet, exercise, meditation, or psychological exercise. Though the words complementary and alternative are often used interchangeably, they're actually different. Complementary is used in addition to conventional medicine, whereas alternative medicine includes non-mainstream practice and is used in place of conventional medicine. There are 5 major domains of CAM: alternative healthcare systems, mind-body interventions, biological-based therapies, therapeutic massage, bodywork, and somatic movement therapies, and energy therapies or bioelectromagnetics. Who uses CAM and why? Complementary and alternative medicine is an important form of healthcare for many people and is present in all countries. For example, about 80% of the people in Africa use traditional medicine as their sole form of healthcare. In France, 75% of the population has used complementary medicine at least once. And in Germany, 77% of pain clinics provide acupuncture. In the United States, depending on the definition, an estimated 6.5 to 43% of the population has used some form of CAM. 38% of American adults and 12% of children have tried CAM in the past year. And in 2011, 83 million American adults claimed to use CAM, spending nearly $34 billion. There are several reasons why people decide to turn to complementary or alternative medicine. For example, one reason is that they're looking for non-toxic, natural remedies. Another reason is that it's less expensive than conventional medication. Another reason is that there are concerns about side effects of conventional medication. Symptoms aren't fully controlled by conventional medicine or the failure of traditional medicinal interventions. For example, studies have shown that there have been reduced chemotherapy-related nausea or reduced pain after surgery in people who have tried acupuncture. Other reasons include that people like to feel more in control. They like to take a more active role in their treatment versus doctors making decisions for them. Some also find comfort from the touch, talk, and time spent during bodywork and therapeutic massage. To the right, you can see the percentage of people and their various reasons. These days, it may seem as though more and more people are interested in complementary and alternative medicine. We just briefly mentioned in the chat box during class the rise in popularity of essential oils. However, complementary and alternative medicine is not a new phenomenon. For example, unorthodox medical treatment was first developed in Europe and the United States in the late 1700s. By 1850, Americans had Thomsonianism, which is an alternative medicine that claims the human body is composed of 4 elements: earth, air, fire, and water, and should be treated with herbs. Hydropathy, which is a therapeutic use of water either internally or externally, or magnetic healing, which relied on hypnotism and suggestions, to name a few. Most popular was homeopathy, which prescribed drugs that were supposed to cure diseases by duplicating the symptoms experienced by the patient, or using treatments that are like the disease. I'll go further into detail later in the presentation. After the Civil War, osteopathy came about in the 1870s. is based off the idea that the body's symptoms are interconnected. Instead of treating specific symptoms or illnesses, osteopathic physicians treat the body as an integrated whole. By the 1890s, chiropractic and naturopathic medicine came about, and in the 20th century, massage therapy and acupuncture. The different types of CAM. One, as mentioned earlier, is alternative medical systems. One example of this is homeopathic medicine. It's based on the idea that the body has the ability to heal itself. If a substance causes a symptom in a healthy person, giving the person a very small amount of the same substance may cure the illness. A homeopathic health practitioner uses pills or liquid mixtures containing an active ingredient from a plant or mineral as treatment for a disease. Some people can use homeopathy for allergies, irritable bowels, or atopic dermatitis. It can also be used to treat minor injuries like cuts and scrapes or muscle sprains, but it's not appropriate for chronic illnesses like cancer or heart disease. These herbal remedies have been regulated in the United States since 1938. However, they must meet FDA standards. Another example is naturopathic medicine. It's based on the belief that the body can heal itself naturally. Naturopathic medicine attempts to improve health, prevent disease, and treat illness by promoting the use of organic foods and exercise, and encouraging a healthy, balanced lifestyle. Naturopathic physicians avoid prescribing medicines or performing surgeries. They can prescribe herbal medicines, nutritional supplements, or homeopathic dilutions. The use of naturopathic medicine for promoting good health, preventing disease, and treating illness is fairly common. Most naturopaths can treat earaches, allergies, and common medical problems. Naturopathic medicine tries to find the cause of the condition rather than focusing solely on treating the symptoms. Another type of CAM is mind-body interventions. This is the most commonly used form and is based on the idea that what a person thinks can and does affect the way the body responds and the way the biochemistry changes. Some of these forms include prayer, yoga, meditation, hypnosis, or biofeedback. Yoga, for example, incorporates meditation and exercise to improve breathing, decrease stress, and maintain health. Studies have shown that yoga helps lower blood pressure, improve a person's sense of well-being, reduces fatigue, and can also help people with asthma learn to breathe more easily. Hypnotherapy includes the use of hypnosis to treat physical or psychological conditions. It's based on the idea that during a hypnotic state, a person may be more likely to accept suggestions that can help his or her behavior. It's not intended to cure diseases, but rather to relieve symptoms of an illness. It can be used to relieve pain associated with surgery, used to control addictions to drugs, alcohol, food, and smoking, and can reduce stress by increasing relaxation. Another example is biofeedback, which uses the mind to control a body function that the body normally regulates automatically, such as skin temperature, muscle tension, and heart rate or blood pressure. In biofeedback, sensors are attached to a person's body and a monitoring device, and then a biofeedback therapist will teach the individual physical and mental exercises that can help that person control these functions. This can help with problems related to stress or blood flow, such as headaches, high blood pressure, sleep disorders, and can also help with chronic pain. Another example of mind-body intervention includes psychoneuroimmunology, or PNI. This field of medicine is about the influence of emotional states such as stress and nervous system activity on the immune function and its effect on the onset and progression of a disease. Stress-influenced conditions can include depression, diabetes, obesity, heart disease, ulcers, etc. PNI includes activities that quiet the mind. One example is Tai Chi, which involves slow, gentle movements, deep breathing, and meditation. Another example is Qigong. It involves a series of postures and exercises, including slow circular movements, regulated breathing, focused meditation, and self-massage. It's believed to relax the mind, muscles, tendons, joints, and inner organs to help improve one's circulation, relieve stress and pain, and restore health. Another type of CAM is biologically based therapies. Biologically based therapies use substances found in nature to help treat illness and or promote wellness. This can include dietary supplements, herbal remedies, or food as healing agents. Some dietary supplements include vitamins, minerals, herbs, botanicals, and amino acids that can be taken via pill, tablet, or liquid form. Herbal remedies include ginkgo biloba, St. John's wort, echinacea, ginseng, green tea, or ephedra. And food that acts as healing agents are fiber, protein, garlic, ginger, or yogurt, to name a few. The FDA does regulate dietary supplements, but they treat them like food rather than medications. Therefore, it's questionable because, unlike drug manufacturers, the makers of supplements don't have to show their products are safe or effective before selling them. Another type of CAM is manipulative and body-based practices. This can include chiropractic medicine, which is the use of spinal manipulation by putting pressure on a joint of the spine to relieve pain. The goal is to increase movement in the joint and relax the muscles. Massage therapy is also helpful in order to reduce tension and pain, improve blood flow, and encourage relaxation through pressure, kneading, and tapping to positively affect one's health. Other types of CAM include energy therapies. In energy therapies, they manipulate the energy field surrounding the body. In magnetic therapy, practitioners of magnetic field therapy believe that interactions between the body, the earth, and other electromagnetic fields cause physical and emotional changes in humans, and that the body's electromagnetic field must be in balance to maintain good health. This can be used for joint problems, migraines, pain after surgery, depression, cancer, or overstretched muscles, or injuries to muscles, ligaments, and tendons for strains and sprains. Another type of energy therapy is acupuncture. This traditionally Chinese-based medicine is based on the idea that one's energy, or qi, flows through and around the body along pathways, which are also called meridians, and that illness occurs when something is blocking or unbalancing one's qi. Acupuncturists believe that by putting very thin needles into your skin at certain points, it will influence the energy flowing back into balance. Another example is acupressure, which is similar to acupuncture, but instead of using needles, practitioners use their fingers, palms, elbows, feet, or special devices to apply pressure to acupoints on the meridians. There are several issues with the use of CAM. One main reason that it's not widely used by physicians is because there's a lack of clinical trials or insufficient scientific evidence to prove how effective or safe these treatments are. For this reason, many insurance companies do not reimburse for CAM